Greetings, everyone. What we're going to do will be highly practical. You've heard the introduction. I'm sure everybody seated here, probably in their homes, their communities, they are familiar with one adult or the other, and everyone is in the process of aging, and that's why this is very important to us. But we want to leverage on technology because technology has come to stay. We live in a world where AI is part and parcel of everyday life now. And also with the collection of big data in mental health and across the world, we definitely cannot do without machine learning. So we go on to the next engagement. I think my colleague will take on from here. Thank you.
Yeah, thank you very much, everyone. We are pleased to be here. And it's a great opportunity to share with all of us here. In the last 2 days, we've had conversations about mental health care and support for adolescents, for young boys, for young girls, for women. Now it's about time to talk about older adults. You'd agree with me that for a number of us here in the next 20 years, we're in that space. And for those of us who live in Africa, well, for those who are in the elite class, we may be able to get around things. But it's important for us to begin to talk about culturally appropriate ways, innovations to support older adults. We'll be introducing 2 important things to us this morning. For those of us who are familiar, yes, good. We'll call it the nominal group technique. And the NGT, the nominal group technique, is to help us come together and think about how to support older adults' mental health care needs in Africa. We have created some documents for us to have, and we expect that we are clustered in a group of 6. Research has also shown that it's best to first start such conversations with individual thinking rather than group thinking. So what we would suggest at this point is for us to sit, close to someone in 6. Want us to bunch up together in 6, such that we'll be able to do this. The first step, which is going to take us 7 minutes, is to think about, so you will get a bunch, and there is a central form that the 6 people in each group would pour their ideas into. So, but you have the first form. You can remove the pin across it. Right.
So they're coming around with packets. And
yeah, so you have a single sheet.
So try to group in 6.
Yes.
To do this exercise. And which sheet is it? Does it have a name?
Yes, the innovation priority sheet.
The innovation priority sheet is what each of your groups should be focusing on first.
Mm-hmm. Yes. Then you write the innovation you feel would solve the problem, right? So we've talked about a lot of things in the last 2 days. And then we've talked about culturally appropriate approaches, right? And then we've talked about how we need to indigenize and localize our solutions, right? So now is the time for you to think in the light of older adults and how we can solve the problem. We are going to be co-creating, and that's the first step. We need to think. As individuals, think about it, write, it could be one challenge that you have observed, and one innovation, as a way of solving it. Older adults. Older adults are people between ages 60 and to infinity in Africa. So it's not supposed to be a conversation yet.
It should be very quiet in the room.
A very quiet session now.
This is an individual activity right now.
Yes, it's an individual activity.
An individual activity. Okay.
You don't need to discuss it.
Yes. Yes, we'll definitely get the innovation now. Thank you.
the challenges and innovation. Just good. So we'll move on to the last 14 minutes. Hello.
Isaac, we may do like 7 minutes so we can have some Q&A.
Oh, great. Thank you. Yes, so we have 7 more minutes to talk about. It's okay. Thank you. Good. To talk about
What you came up with. Just 3. You'll go? Great.
talk about innovation, talk about the pestle analysis, opportunities and challenges, briefly.
Okay, all right. So, good afternoon.
Yeah, good afternoon.
Afternoon.
I'm Ruth.
Attention,
Oladele
please.
I'm Ruth Oladele from Nigeria. And so, in my group, we came up with an innovation that we have called PhD Mentors in Adopt a Granny program. So, the Adopt a Granny program. So, for older adults, we've realized that loneliness is actually quite common among them because most of them have had their kids married, they are retired, and then they are the only ones who actually live in at home. And then in Africa, in some communities in Africa, there are also homeless children too, people who stay on the street. Yeah. So the Adopt a Granny system would work with the fact that this older adult, right, so the PHCs now, the community healthcare workers will actually play a role as serving as mentors. And then there will be the homeless person who actually decide to adopt, or either way around, the granny adopts a kid, so the person stays with the granny. So that way we actually are reducing the problem of loneliness. And then also the healthcare workers in the community are involved. So they serve as a mentor. So they do home visits to ensure that the granny, the older adult, and also the homeless child are in sync. So that way we actually are solving the problem of loneliness in the older adult, and also solving the problem of homelessness too, also with that. Okay, so for the personal analysis, right, the opportunities for the political factors, what we have here is that, yes, we have PHC support and Ministry of Health, and then might be perceived as an additional work, especially in the fact that some PHCs probably don't have enough healthcare workers too also. But I think this can also be addressed with the fact that we've realized that community members are always eager to actually help, fellow people too, right? So younger people in the community could actually be trained to actually work alongside the PHC guys.
The economic challenges and opportunities.
Okay, that's challenges. That's opportunity too.
So the idea is not for us to solve the problems. Okay. The challenges we have identified.
Okay.
This room is not enough to solve that. I like the political opportunities, the challenges, the economic opportunities.
The challenges. Okay.
Just one, not even more than one.
That.
So, economic.
Okay, the economic challenges, opportunities, that will be resources allocated to PHCs. No, the challenges would be the fact that PHCs actually have strained resources systems. So also, maybe there could be resource constraint in that part of it. Then for the social factors, the opportunities would be that we're actually going to be reducing the level of homelessness, then also reducing loneliness in the elderly. And challenges could actually be that for the homeless children, it's possible that they already have high rates of social stressors, bad habits that may not work well.
Economic?
Older adults. Okay, the economic factors that will actually
technological,
be the budgets, the budget allocation for that. Yes. Then technological factors for the older adults, technological factors could actually be that probably we've not thought about that way, but we're thinking that if we could also have it a bit digitalized, it's possible that some of these older adults, especially in Africa, might not be able to use their devices well. So might have to make it probably as simple as possible. That's another opportunity, and then leverage maybe SMS model, basically.
The legal factors.
Okay, legal factors or ethical factors. Now, challenges will actually have to do with the adoption system too, because we have to look at what policies actually support that, and then how to are people actually willing to also have other people stay with them?
Thank you very much. Please
Thank
give her a
you.
round of applause. Adopt a granny.
Yeah,
That's what they came up
The
with.
group here.
Okay. So he's going to speak?
The innovation, the pestle analysis.
Okay. So hello everyone, my name is Olivia Machabane from South Africa. And so our group, the innovation that we spoke about is a home health assistant. So somebody who comes in and checks in with the older adults once a week, assists with doing their groceries, making sure that they attend their clinic visits, their medication support, and just monitors their health. So the pestle, this one is funny. So the first one, the political factors, well, the team thought that to start off this initiative, because in Africa and many African countries, we also have quite like our leadership, country leadership tends to be more on the older side. So we thought that we could actually start initiating this from the legal perspective as well. So from the political parties, from that avenue to ensure that we get the buy-in and they also are able to identify the benefits of it, and then it can be rolled out to the rest of the country.
Economic?
We felt it would also assist with solving unemployment in a sense, because the assistants would get employment. These would be people who would ordinarily not have been employed. And then in terms of the social factors, it builds community because there's connection. There's somebody who's coming and spending time with the older adults. Technological factors, the individual could also assist in terms of educating the older adults. For instance, if they want to do video calls with their children in, faraway regions, they'd be able to have that, and also that again strengthens the community building. Environmental factors, we said. We didn't look at that. And then the legal factors, again, supporting them if there's any kind of abuses that have happened or anything that's happened in the community that they've been exposed to, they'll be able to identify that and get legal support.
Thank you very much. Thank you very much.
One more group.
Adopt a
There's a
senior.
group of
I'm Wilson. I'm a clinical psychologist. So we've come up with a shared community of elders with young people. So in Africa, we usually build along a certain village, a certain small township or something. So we are going to build a home of about 20 families. So we are 6 here, and then we are going to bring our grandparents and then our older parents, our senior citizens, and then put them in that home. And then we, the young people, are going to be accessing them by, over the weekends when we are not working in the towns and go visit them, but also we know that they are being cared for by other young people, and they are checking on their health and their well-being, and then we are visiting them and having interactions, and then we are having conversations around passing on knowledge, literature, older literature, and everything around that. But also, if we have some doctors, if we have some professors, there is a process of getting to exchange knowledge. If you're still studying, if you can access these people, it's a human library.
Pestle.
So, yeah.
So that suggests an intergenerational arrangement. Fantastic. So the pestle.
Political factors.
Yes.
Well, very many politicians are senior citizens, so they will accept.
Fantastic.
They will accept the idea. Yeah.
Good.
Then economic factors, we are looking at a shared space is that, you don't have to travel 100 miles to go and see your grandparents. They are somewhere accessible. So, yeah, that's the biggest challenge. Social is, it's culturally acceptable. Well, because in Africa, we have always lived together. Even in our smallest houses, it's only now that we build very big houses and they are empty for us, So then the technological factors, the young people have the exposure to the tech. but also the older people get to watch TV, Netflix, and things like that. Yeah. So so they can have that, but also we can try to be innovative for, for what they like, because we can run around this tech.
Great.
Environmental factors still challenging. The legal aspect is that we can safeguard our older citizens from abuse, from neglect. We are able to protect their wills. We are able to, we've watched where,
Great.
Yeah, parents.
Thank you. Please give a round of applause to the intergenerational living arrangement group. Good. We'll take the last group from behind, with the permission from.
Is this on?
Great.
Good afternoon, everybody. I'll try to be brief. Me and my impressive colleagues would like to introduce Long Life Village.
Fantastic.
And it's pretty cool. So we wanted to introduce like the concept of a living space that centered a few things. One of them being like a space that kind of like assisted living, but that reflects more of the typical sort of community space, not something that's like isolated, but something that reminds our elders of home. We also wanted to make sure that they had like a GPS tracker was suggested, just something to just kind of help people keep track, feel comforted. We also wanted to make sure that there was like more of an embedded communal sense, so more expected like communication, if you will, like built-in groups. And then there was like a component of like family, sort of like family engagement, family memory exercises, like looking at pictures or spending time with like the youngest person in your family. And then one of the last ideas was something that included like free healthcare, or just like something that navigated the insurance difficulties. So those are pretty much the components of
Pestel?
Long Life Village. And
Pestel.
so should I talk about political and, okay. So the political aspect is that we're taking care of our elders. And I think that means a lot for, not only the continent, but the country, but just the preservation of culture and wisdom. From the economic side, we're kind of covering things with the sort of like trying to get as close to free healthcare and tackling the insurance issues as possible. I think with the societal factors, just really emphasizing that group sort of embedded engagement, family engagement dynamic is helpful for also not only building and strengthening community, but continuing like cultural sharing, collective sharing. The technological factors, the GPS, the tracker, having that you can just kind of check on your, grandparent and just see if they're good, make sure they're safe. With the environmental factor, I think it just means a lot to have a space that is reflective of one's home community or the place that they grew up, as opposed to having some concrete, bland structure. And then for the legal sort of ethical factors, I think it's important to build a space that has like a spirit of advocacy. So making sure that if there are issues, like families can speak up, the elders feel heard about some of the things that not just brushed off and feeling forgotten or feeling isolated just because they're elders and they're not as sort of quick as everybody else or something like that.
Yes,
so
let's jam your hands together for that group.
That's all.
So we've come to the end of the consensus building, and we've been able to listen to the feedback from each of the groups. And this is to tell us that as much as we want to be innovative, we have to build our solutions within the context of our culture, right? And I feel that was primarily the reason myself and my colleague were able to fit into the aging and technology space, because we came with a social science and culture or anthropology co-background to understanding the problems of aging in Africa. We will take questions. Okay.
Yeah, we have like a minute or two for questions. So does anyone have a question or comment, maybe about this exercise, or about just aging in Africa from our two experts up here? I don't have the mic on, sorry.
Okay.
Right. So my name is Jane. I have aging parents, like most of us here do. And I happen to live and work in Australia, where I have worked in an aged care facility. In Africa, we don't have aged care facilities, but I'm just wondering, from my perspective, I've been thinking about, how can we bring something similar, a similar concept to our society here, because our aging parents depend on peers around them. But I realized, like in my neighborhood, for example, we used to have about 10 neighbors, but we've only got 5 left. So they're trickling down, and they're, every day they're getting less and less. So I was wondering whether, I know we look after our aged, we live together, like we've suggested, we look after them ourselves as children, but now a lot of children have left. They've gone overseas, they've gone to the cities, they've gone, So these parents are lonely, and their age mates are leaving one by one. We can't do anything about that. So now I was wondering, have you ever in your research thought about how we can bring them together to have, each other as peers or something like that? Because that's what I find, for example, where I have worked before in Australia. They end up together. It's like, sorry to say, it's like a boarding school concept kind of thing, where, sorry to call it that way, but it kind of gives them, each other to look, to be together, have company, play games, go for excursions. Great. Things like that. Have we ever had any thoughts of something similar?
Great, thank you very much. One of the innovations that we came up with this afternoon was to create an intergenerational system. Definitely because in Australia the life expectancy is higher. You're likely to have more people stick for much longer than we have in Africa. The arrangement, whether to be taken out of their current space, they prefer to live or to age in place, depending on their choice or preference, is also tied to their cultural beliefs. And intergenerational relations is a strong element of our culture as Africans. So even if we would be replicating a Western idea, it has to respond to the cultural imperatives of the African people. And that is why it's been a struggle for people, especially entrepreneurs who want to replicate some of the models in other parts of the world in Africa, because those things do not align with our cultural imperatives. And in as much as they do not align, they remain unacceptable. They are acceptable in those parts of the world because those models align with the cultural imperatives. So, concerning your parents, it's a bit of this and that. Think about how to link them up with their peers and create a network of intergenerational relations as well. Thank you very much.
Okay.
Thank you, everybody. Thank you.
Yeah, just to add on that, one of our studies we had done before in the past, we had to start with mapping out available community resources that could help to support older adults. We have to identify them first, like we identify them in that community where your parents live. Then we now look at the way forward on how we can harness these resources to help their well-being. Thank you.
Before we go, we want to acknowledge the support we have received either to be in this place. Professor Henderson has been our mentor and has had us under his wings since 2018, if I'm correct. And yes, he's really been supportive. And of course, I want to thank Dr. Michelle as well. She's been amazing. And I want to thank Sinai. Amazing people. So I got the first shot with a webinar to talk about the mental health of older adults. I think she talked about it yesterday, and it was a big event because it was like a way of answering the questions in the hearts of people, and then of course because it's the science coming back to the community. And so I want to thank everyone today for coming.